I practice in the West, and of course, you know, the Marlboro man back from the days, and certainly, you know, the Montana Cowboy is still a stereotypical image of the man from the West, but sadly, you know, we've got some very good examples of some older actors who look pretty weathered. Certainly as time goes on, men are becoming more and more aware that there are some things, and even minor things, that maybe don't even necessarily make them feel like they're pulling from their masculinity, to just maintain a good, healthy appearance. And that's really what men, I think, are after, is trying to appear normal. They don't want to necessarily look done, they don't want to look as though they've had plastic surgery, but they want to look normal. And the aging process, in the eyes of most patients and certainly the world, isn't necessarily a normal thing. So if we can maintain what they've got, and doing oftentimes very little things like Botox, skin care, treatments for fatty deposits in the neck, or dealing with a heavy neck with a facelift, we can really help these men keep their masculinity but still improve their overall appearance. Now, of course, there are other things that men have always been concerned about as they age and their clothing starts fitting differently. We'll do more and more things to men in the chest when they start to get a little bit of heaviness in the chest that happens with aging and some of the male hormonal changes that occur. So removing excess breast tissue, doing liposuction, really is a very popular, common thing for us to do in my practice. And then likewise, of course, in the abdominal area, we do a lot of liposuction around the abdomen and on the love handles. Men in the practice are really a lot of fun. I have a very heavily weighted office staff that are women, so when we get men in, they are very welcomed and they feel like they should, which is a rock star when they're in the office.